This is Dr. Cho from Southern Dental Implants and Oral Surgery in Asheville, North Carolina. I sometimes get questions from our dental colleagues what multi-unit abutments are. So I'm going to create a few serious topics on what they are and why we use it and how we can utilize it in the next few posts. In a traditional typical dental implant, you have this straight healing abutment, and then basically you use this straight screw access for prosthesis. However, oftentimes in full arch, there's times where you have to angle correct, not even for full arch, but sometimes single fixture or small fixture too. In that case, if there's enough restorative space, you could use this angle correction. That's the biggest advantage of having a multi-unit abutment. Basically, you can put this screw in there. There's a little screw there that goes in. They could sit to the implant, and then once you secure that, you have an angle corrector. In this case, this is a 17-degree Straumann SRA, and instead of having to come out parallel to the implant axis, you can do angle correction to make sure the screw axis angulation communicates with the rest of the full arch implant. The second key function for multi-unit abutment is that it creates common prosthetic platform. So whether you have a wider or narrower, and oftentimes a lot of MUAs share a common screw that gets seated there. So by the time, you imagine this is a tissue here, by the time patient hears and patient goes back to the restorative dentist, all we have to worry about is the platform of the MUA across all of the implants in the full arch, which makes the restorative process, the prosthetic design and fabrication process, a lot more simpler instead of having to worry about 4 or 5 or 6 or plus different kind of platforms that each different implant has. Third advantage of multi-unit abutment is that sometimes due to biological or anatomical limitations, the platform of the implant when they are placed may not necessarily be same level. Sometimes some may be a little deeper, some may be a little higher. In that case, there's different height and angulation of the multi-unit, so that by the time all the MUAs are placed, either straight 17 or 45 degree, and tissues here, they are basically all at the same level instead of having at the different levels, which makes the prosthetic design a lot simpler, and also increases the longevity of the cleaning, longevity of the prosthesis, as it makes the cleaning a lot easier at patient's end. The fourth advantage of multi-unit abutment is the soft tissue adaptation and its improvement. When we have basically single straight regular healing abutment that comes out from the bone, and this is usually the part where it's adapted by the tissue. Sometimes the emergence profile could be less than optimistic, but as you can see on this very smooth multi-unit abutment by Straumann, which is 17-degree correction in this case, you can see how easily the soft tissue could adapt around the height of multi-unit abutment above the bone, which just makes the hygiene and then soft tissue adaptation a lot more simpler, which further improves the prosthetic design and the workflow, and also ease of hygiene, and just make the longevity of the final prosthesis a lot more predictable and simpler.